do. We are all excited about people who want to do so.
Yeah.
Okay. Stephanie and the family from Montreal, Quebec, anyway.
Okay.
My geography is terrible.
Oh, yeah. Okay.
Is on the Zoom, which is why we're trying to stay in view of the cameras.
Okay.
And
yeah, we shared the link
awesome.
so that people
awesome.
could.
This is an open.
No, yeah, you're fine.
No, it's fine. I like how little man over here is like, I'm going to take up 2 chairs.
It's
like a couch. Come.
No, I appreciate that, guys. Yeah. Any other
Absolutely. You guys are doing a ton in the space, so we're thrilled that.
Yeah, right now I'm sure we're in Alexander disease.
Sam, don't
Yeah,
take 2
absolutely.
seats.
Yes.
Scoot over. Hey, you can't take 2.
Hi.
No, yeah. Samuel.
Hello.
Hi.
So we're just the LCC crew.
Yes.
I'm Jamie Fraser. I'm at Children's National.
I am Ashley Dyke. I am the founder of. I'm Ashley Dyke. I am the founder of the LCC Foundation. Yeah. And mom of, and president. And mom of Ben, who has, Super Ben, who has LCC. Am I passing it around? Yeah. Oh, yeah. Okay. You're going to say your name?
I'm Sam.
You want to help Ben out there?
Oh, yeah. Ben, you want to say something?
My name is Mariam, and I met Ben this morning, and he's wonderful. And my daughter is Anvera. She's not here. She's with her brother. And she have AJBC leukodystrophy.
I'm Eli.
I'm Danny, spouse of Ashley and dad to Ben and the other crew.
I'm Zach.
And I'm Courtney Bisbee. I work in patient advocacy at Ionis Pharmaceuticals, and I'm excited to learn more from you guys today.
Okay, thanks. Were you able to join yesterday?
I was here for half of the scientific symposium.
Okay. Were you able to catch our 1:30 talk where we talked about the natural history?
I missed it.
Oh, no. Okay.
My flight was delayed by more.
Bummer. Oh, that's perfect. Thank you.
Okay.
So I want to open this up. I am here to address questions. Ashley, do you think, for the purposes of other folks, do you want to talk a little bit about LCC and what, as parents, you think about it, what your LCC mission is? I don't know how much you guys have talked before, but.
No, yeah, we just met.
5 minutes walking
Yes, so LCC is leukoencephalopathy with brain calcifications and cysts. Ben was diagnosed April of 22, and then we were quickly connected with Fraser. And then, because she's the only one, Jamie, sorry. I like calling you Dr. Fraser. Yeah. But yeah, so we got connected with her, and she's the only one here in the States doing research that we know of. I think there's one other person in California, but they're working on it, but not a physician that is treating or trying to treat. So yeah, we got connected with her, and then it was a year later we were asked to form a nonprofit to then further opportunities for her to get grants and things like that. So I raised my hand to do that. I have a legal background, so I was able to navigate the court system in our local county, and form that nonprofit. And then from there, we've been trying to learn as much as we can, raise funds as best we can, so they can continue doing what they're doing. They have the mice model and all of that. So yeah, so that's what we're working towards now as a foundation. It's just continuing to raise funds and awareness. We've got a lot of ideas, trying to get those moving. Yeah, we have a board of other patients. I think 2 or 3 patients are on the board at this point, and it's a lot of parents, you know, all trying to just get together. So yeah.
Yep. And so with their support, we have started a natural history study that is now including 28 individuals from 22 families over, I don't know, 6, 7 countries now, all over the world. We are actively looking for as many other people who can join this study as possible so that we can obtain enough data to try to figure out how we best design clinical trial readiness studies, so COAs and clinical outcome assessments and biomarkers to help us get there. In addition to that, we worked with Jack's Labs, and they sponsored the production of an LCC knock-in variant mouse and a knockout mouse that was a bystander mouse. And so we have both of those. The knockout mouse is not very helpful because it is embryonic lethal, which means that they don't make babies who have disease. It's too severe. And the knock-in mouse recapitulates or mimics the disease phenotype, and we actually get both pediatric disease intermittently with more of the adult disease phenotype in the mice. And so now we're working on trying to figure out how to stress the mice at appropriate times to better mimic the pediatric disease because it moves faster, so that we can target therapies that we can catch in the mouse and in the humans faster than waiting on a mouse that's not month old. So that's where we're headed with that. We have some repurposing goals from a couple of off-label access drugs that we're trying to do, working with regulatory bodies who don't understand when you're coming from a mobilizing a generic drug and trying to pay for a study off of a generic drug has been really fun. And so we're still navigating that, but the protocol is essentially written, and so the next step is figuring out who to navigate through for a pre IND meeting. So that's where we're headed next. Yeah, so the additional issues there are that there are still a lot of people who are going undiagnosed because it's hard to detect. Even on, you can't really detect it always on exome unless you know where you're sending it, you know what to ask for. Genomes are not always covered by Medicaids especially. And the panel testing that Invitae offers doesn't cover the 3' extension, even though they have been educated about the fact that those variants are very common, and they have not chosen to include it in their registry panel. So we've worked really hard to try to get the various labs on point with that, and to help them add this disease on to those panels and exome catchments. And so, thanks. So now I think there's been another disease that's an RNA gene that is a very common neurodevelopmental intellectual disability gene that we've recently also been a part of the group publishing on. And I think the prevalence of that disease, which is as common as Fragile X in the community, will force these labs to actually include non-coding genes that are known to be associated with disease onto their catchment region of interest platforms for testing. So we're going to hope that that's going to be helpful. What you need, Sam? You okay?
He needs the Wi-Fi password. He'll be fine.
You can wait until we're done with this.
Yeah.
Or, you know, it's ULF United, right? All underscore, all lowercase. Huh?
Yeah, even nicer. I was close.
It's for Ben, right?
Remember.
Just for Ben. I like you, Sam. Okay. So, questions, thoughts, ideas? What do you want to? I mean, this is kind of for y'all, so.
I wish we had questions from the patient community, but I didn't get any prior to. Sure, everyone's wondering maybe where we are at with clinical trial efforts.
Yeah, so
Yeah.
where we are at is I spent the last 6 months trying to get FDA to help me understand where to go. And everybody says, go this place, go that place, go the other place. And in the meantime, I've been working on the protocol. So what the thing that is gonna be the hardest part is because funding is going to be hard to come by. I don't want families trying to travel, from all over the world to try to get here for clinical trials. And so we're trying to figure out, like, how do we capture the things we really need to capture remotely? And so right now we're doing some videos that some folks have sent us to try to look to see if we can see whether we can measure those metrics by video. So hang on a second. Do we have anybody besides Stephanie? Is there anybody else on the chat?
Stephanie.
Okay. So what I think we're probably going to do is I'm going to have, we'll work together to put a meeting together remotely and talk about next steps for data collection remotely so that we can do as much tele-research as possible.
Yeah.
And then working with some of the other families, providers in other countries to see if we can do something there. That's going to be a big effort because they're going to need to have financial support that I don't have. I mean, we're doing all of this sort of on a dime-size budget.
Yeah.
So
Absolutely.
I have one more thing I'm going to Hail Mary pass on and see if we can get some support from David Faggenbaum's organization, Every Cure. But I've reached out to them multiple times without a response. I think they've been like slammed with people asking for help. But I talked to Melody from LBSL, and so she's going to put us in contact. And so that's my next attempt to see if we can get some help.
Cool. Okay.
Yeah. Yep. Because we need to get things moving on this.
Yeah. Yes.
Okay.
No, I don't know. Do you have any other questions?
I have a general question that I'm just curious for. Given the rarity of the disease, do you find that international patients are now and families are starting to reach out to the LCC Foundation for more information since you've gotten things up and running?
Not necessarily. There is also a Facebook page or group. I think it's a group that's private and that is run by, I think it's been on there since
17,
yeah.
16, 17. As soon as the families that were sort of known from Yannick Crow's paper, I think founded it as part of their connection efforts. And it's been going since then.
So then they already kind of had that group established, and I do connect into that, and I'm also an admin, but that's how I'll try to communicate with most of the patients or caregivers. But I'm hoping to expand, like the opportunity through our website. That's what I'm kind of focused on right now. I've got a media group working on like a legit website versus just one I created on Squarespace. So I'm trying to get that kind of like established, and then looking into they're gonna try to build out a portal which would then allow all of the patient community to come join the community or register with us, and then we could better follow and update and they could even have private conversations because it would be password protected. So that's kind of that's a big goal right now for us, that we've been working on that, and then obviously fundraising ideas. So that's
it started as social media, right, which is great because you outreach people, but then you get into now how do we like make this a little
operationalize
more secure,
this,
right? Like everybody's seeing
yeah.
this out there on some page.
Yeah.
And being able to do that. So I think that's where
that's what we've heard.
It is very international, just to be clear, but it wasn't like because the LCC Foundation. I think that was already sort of there. So like when we look at even who's involved actively in the foundation, we've got a couple different families from Canada.
Yeah.
So as we've been talking about fundraising, that's been probably the biggest challenge is one, getting started and getting fundraising when you're just like a handful of families going out, right? And then you add on to, okay, well, we've got maybe some potential donors here in Canada. How do I get the tax break for that? Because, a big donor is going to want to get the tax, like the benefit of that. And if it's like going into a U.S. 501c3, which we think, that's great, like they don't get credit for it. So that's one of the things that we're trying to figure out now, like how we navigate some of
Which
that.
I think I have from this conference. I do have a resource for that particular.
But that's for Canada. Right,
And
which
it's
is
going to
all
be
good
different.
and
It's going to be
bad,
different
but
for every
then
single
what about Europe?
Yeah.
country
So
or the
that's
EU.
for Canada. I do have a
We
resource
get a
for
few
that,
in
but
Australia
that
and
doesn't.
it's pretty cool.
That's not necessarily helping our. We did have a opportunity for like a Canadian family was really wanting to do a huge charity event, but they had to have a 501c3 or equivalent, like charity status, and I'm unable to help truly get that going. I don't know all that entails, so that's one issue we've kind of run into as a foundation, and I don't even know that that's necessary, but
You want to maximize the reward people get for being charitable, and so that's the place where it's like
right.
helping them figure that out is going to be tricky. But I think there may be some other resources we can tap into. We'll see.
Yeah, I'm like, does that require maybe an attorney? like,
TBD.
Yeah.
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 You know,
so-
somebody else who might know this is, have you talked to the advocacy folks through the GLIA or the ULF here, like the main ULF, about if they've ever received international support, charitable support?
Yes, that's who I got.
Oh, that's who you got it from?
Yeah,
Perfect,
in
okay.
the patient advocacy meeting
Excellent.
last night.
Okay.
Yeah, that was
That's
able.
good. I was thinking
Yeah.
too, who else has gone through this challenge and what can we learn from them? Like
Yeah.
others who might
Yeah.
be a little bit ahead of the process, like
Yeah.
tapping into that, some of those advocacy groups.
Watching funny
They're like
videos.
amazing.
I know.
So sweet. Okay. Yeah. So just to let everybody know, this is Brianna. She is the lead tech in my lab who's responsible for.
Couldn't find the right room.
Oh, no. And who's responsible for the bulk of the work that you saw in the talk from the last year or so and the poster that's on the wall. So we've had a ton of data. We've actually found recurrent variants and like there are hot spots in this very tiny little gene. It's a highly attractive gene for gene therapy because it's literally 150 odd bases.
It's already RNA based.
So if we can, long run is let's get to gene therapy. Short run is let's find disease modifying therapies that we can mobilize quickly. So that's where we are.
Yeah.
Got the animal models to do some of the work. We've got patients who are eager, and it's just about trying to mobilize resources. What are y'all watching?
Funny videos on YouTube.
Never found
Like funny.
Yeah.
So
funny cat.
back to like Ashley was asking about clinical trials and like
Yeah.
where we're at.
Yes.
How do we think about like where you're at with drug repurposing and going down that pathway?
Yeah.
And are there more than one
Yes.
option you have in place
Yes.
there? Like
Well,
you're thinking of, and then
so there's another option that opened up yesterday after my talk
Okay.
that Dr. Bonkowski put me in touch with a couple of other individuals from a couple of different pharmaceutical companies. And there's some attractive places we could probably move on that as well.
That's good news.
Yeah, well, I mean, they have a long way to go on that, but like,
Yeah.
not as long as gene therapy. Like,
Right.
We have to do some very quick and dirty experiments in the lab with some of the mouse probably
Yeah.
before we can say yes, absolutely, we have to do this. But there's some data out there that already suggests that we have a place that can go beyond the drugs that have available right now.
Okay.
Yep.
are they currently marketed drugs then?
They're on trial for other things. They're not marketed, but they're under trial for other things.
Okay.
That are
Oh.
yeah.
I was just curious. I saw something this morning when they were showing about using JAKs for something.
Yeah, that's probably for your Cardigutieras, the JAK-STAT inhibitors. Yeah. Those are pretty hard.
Those are scary drugs.
Yeah.
I'm just saying. That's what I saw.
I mean, like on a scale of like Avastin
Yeah.
to the JAK
Yeah.
inhibitors to the things that we're thinking about,
Yeah.
I think we need to be over here. We don't maybe need to be over there.
No.
The bleeding risk and things without an evidence of benefit make me nervous.
And then gene therapy, like where are you at? Like where, like as far as the mouse models and like thinking about what?
Yeah.
I Gotta ask.
I know. So one of the first things we need to do is we need to like find a way to tighten up the timeline on the mice for like consistent disease progression. Because right now the same mice with the exact same change can like crash and burn at 40 days of age. or
Yeah.
250 days of age.
In mass terms, that's
Th-
someone
that's-
who's a young adult or someone who is middle-aged.
Yeah,
But
just like the people do,
Yeah.
literally.
Okay. Yeah.
and the decline is similar, we just need to make it
We
earlier.
just need to we need to, in the lifespan of the mice, we need to make it faster so we can say,
This is a pediatric
you know,
condition.
if the slope of the line that you're looking for is, like, I'm gonna draw this upside down.
Phenotypes, we're seeing the right sex differences, we're seeing a similar rate of decline.
So like,
frankly.
survival for most of these mice looks like this. This is how you draw a survival curve, right? And so this is a wide window of time between start to see illness that's causing death and the last miles to go. Okay, that's too tight. What we would like to get to is something that looks like this, so that if we give a drug and that drug then spaces this to that, then we can see measurable effect. Does that make sense? And so we've got, because the kids have told their stories, and oh my gosh, yeah, that's the best sound ever. I don't know what video this is, but I need it for later. Sam, what is he watching?
Funny videos
What?
with cats.
Oh, with cats. Okay, yeah. Cats.
I mean, like honestly, with Ben though, it could be a black screen, and then we could say something about Sam, and he would make that sound.
Yeah. He loves to laugh.
Yeah, that's my favorite sound is a laughing Ben. Usually I get to see tired Ben, so. But it's
I know,
great
you're
though.
like,
I'd hear from the other room and be like, "Is he okay? Yeah, he's
He's laughing. Okay.
I'm like downstairs working, and I'm like,
Is that okay? Is that an okay noise or a scary noise?
Laughing or screaming.
Sometimes we do both. Why not both?
Yeah. It really is.
So the goal here is really to just get something that's so tight that there's no doubt that we're seeing an impact. Because right now, like we talked about with the scientific meeting, and Dr. Vandernap's story was like exactly spot on. We've had the same thing. We've seen kids who've not been on Avastin who've had essentially changes in course and changes in presentation, right?
Yeah.
And you've done nothing. And their disease evolves differently than another kid who's progressed really fast. And I don't know that there's not been enough well-controlled evidence of effect to say that we are seeing anything. And the risk of bleeding into those spaces, I mean, we see people spontaneously bleed into their cysts, that like, it's hard to control those things. It's hard to make sure you have that level of control. And
We're not seeing a change in the total volume of blood vessels. We're not seeing a
Yeah.
change in their So we're not seeing
that's late. Yeah. So.
Yeah, where are we at with the male mice? Like, are they kind of? Because I know you guys had trouble with it even early on, right?
So the male mice do what the male kids do for the most part. Yeah, and there seems to be there's the weight difference, there's a size difference, and it's okay. It is okay. The happiest sound in the world is Ben Dyke laughing, so please don't. Please don't apologize. I love Sam. You need to like pull it down to like a 2. I just need you to be like a 2. Like this is so not a big deal. Like he's not misbehaving. He's happy.
Okay.
So the male mice have so the slope of the male line looks like, if we use this as the males, right? The females do this. And like we ended up having to stop the study at 2 years on the female mice, and we still had 4 female mice alive.
Wow.
So,
Okay.
and they had, 4 out of 15, something like that. But like they were still, and they were not losing weight. Like when they start to lose weight, they kind of go quickly.
Yeah.
And so the male mice are relative to the male unaffected mice. Their sizes are already smaller. They're smaller from the beginning than the females are relative to their litter mates.
Yeah.
And then their decline was much more precipitous, but still not in a way that's reproducible enough to get it tight to be able to expand. So we need to, because the kids are showing us that between having probably some prenatal stress that increases inflammation in the brain and having that first seizure within a year of life, those kids who have that backstory present earlier, but
Yeah.
the females actually don't, they're not small, even if they present that way.
Oh, wow. Okay.
The males do though, and the males with more stress show more. So I think that we know that in other models of neurological disease that are unrelated to leukodystrophies and unrelated to even genetic conditions, like perinatal asphyxia models, hypoxic ischemic injury, male brain cells die differently than female brain cells do. They're just programmed to die differently, even in the period before they're getting estrogen or testosterone or anything like that.
Wow.
And so,
Systems are built a little differently.
That's
and their cell death mechanisms are different. Yeah, but there's also this little period of
There's a joke. I'm just waiting.
no, there's not. Like only you, Denny. In this moment, it's really only just you laughing on the inside. But there's also this thing that happens in the first few months of life where they have this thing called the mini puberty of infancy, and so human infants get this surge of sex hormones as they're being born. So like mom's hormones are coming away, the sex hormones from the guys and the girls kind of do this little early surge, and then they kind of go back down. And so I don't know if that's also playing a factor either, but we're
About
seeing
what age does that happen? Is it
like within the first 3 months.
3 months?
Yeah, and it's waned out by the first 6. So
Okay. He had his first, I was just curious because Ben had his first seizure event when he was 5 months.
yeah.
So, and then it stopped.
It just they go away, and then they come back later.
And then, yeah, like,
Seeing a couple of babies that are born, they have a seizure shortly after birth, and then nothing until adulthood.
Yeah.
Yeah.
he had a few seizures over a few day period of time, nothing after that. A little bit slow in development, but still fairly like it was normal enough that we didn't.
That nobody
know
got
anything,
nervous,
right?
yeah.
And walked the whole thing, and then started to decline. It's kind of, I mean, it lines up to the story we're telling here.
Yeah. Yeah, and that's why it took us 8 years to get a diagnosis, and then
From that first seizure,
from the first seizure. Yeah.
because again,
yeah.
people don't think too hard about otherwise healthy babies who have a seizure. I mean, like nowadays they'll do genetic testing, but this gene is not on those early seizure panels, for example.
Well, we did
Yeah.
have genetic testing early on, even,
Yep.
but and
Yeah.
it just didn't because that
It was microarray. Yeah. not that much.
Yeah, it was.
But nowadays they'll start with a seizure panel, and it's not on the seizure panel because
Uh,
even though Dr. Crow's group sort of reported that early seizures happen, I don't know whether labs did sort of see that and do something with it. But we're hoping to have our big natural history paper out submitted by in the summer.
When you say it's
and
not
that
on the
would help
panel,
them
That would
get
help them.
help
specifically
get.
LCC, specifically
Snort 118.
Yeah,
Mhm,
and
yeah.
that would your paper would help then get it
Yeah,
on the
I mean,
panel.
like to the point where I will just send it to the
That was
labs
my question
Yeah.
myself.
Yeah, because I was like, how can I advocate for that?
Yeah, well, I mean, like we're gonna blow it up on social media. So what we're
Okay.
gonna do. Like, don't worry about
Okay.
that. We got that. I got the plan for that.
Okay.
How many testing
tell me
labs
when.
are there? Because I envision Ashley calling every single
Yeah.
one of them.
So the thing is, it changes by the week.
Okay.
So like Invitae, which was running a leukodystrophy panel,
Yeah.
is now bankrupt and they've been folded into LabCorp. For better words. There's Quest. There's this company now called AI Life that does genomes, and they were apparently I've never heard of them until last week for a different reason. There's Baylor. There's Prevention Genetics. There's GeneDx. There's Ambry. I'm forgetting a few somewhere. Yeah.
Yeah.
And so I have like this running list of labs that I've been in contact with trying to figure out how we can do things. My usual go-to is if I'm suspicious, I've helped another neurologist do this with a patient that we knew had LCC by phenotype. She had an Invitae panel that was negative. I was like, she has to have a rapid exome because she got very sick very quickly. She has to have a rapid exome. And I literally emailed the literal words for her. I slammed it down too hard. I emailed her the literal words to put in the request to make sure that they looked all the way through. And they didn't report it on the rapid because they were variants of uncertain significance. But when the thing resulted 2 weeks later, there they were. And she had 3 variants, and then 2 were on one copy and 1 was on the other. And they'd been seen before. So the more variants we include in this paper, which is why we've like slowed it down a little because we got so many new requests to join, that we wanted to include both the early seizure phenotype, the prematurity and growth restriction phenotype, and get as many variants as we could. And with Brianna's help,
Document the premature versus
Yeah.
phenotype.
yeah. And those seizures, I mean, like, they'll talk about the early seizures, but they didn't talk about it in terms of total number. And when you look at the number, like, the percentages are just too high to be, like, that's not a normal number of people to, like, just, 45% of these kids had a first seizure, and then, like, they kind of got better, and maybe they had some CP or developmental delay, and then, like, so, yeah, it's kind of infuriating. But again, I think we have to keep in mind that, like, this disease found a gene in 2016. And the genetic testing labs have still not fully caught up with the fact that this gene disease association exists in functional ways to detect it. And so we're getting better with detection, but I've literally been on the phone with folks saying, hey, can we fund and I finally found the way in with GeneDx to fund a sponsored test to sequence this gene, funded by a nonprofit, supported by a nonprofit, so that we can get people who need this testing done. And so that's the next step. And so I'm working through the process with them, but it's like.
So trying to reach out to people who've been documented in the literature internationally. Where there's a language barrier or the health systems are disparate, we can't all get
getting records has been super hard. I mean, getting contact hasn't been really the problem so much as.
Families in mainland China, there are a couple families in Japan.
And I've reached out to the Japanese and haven't heard anything, so.
We're having trouble for obvious reasons.
And there are like legal implications with having to deal with certain other countries, and so we're facing that in a lot of ways. But like we've been able to get interpreters for like when we needed to have one for German, we had one. We've had Spanish interpreters that have worked pretty well. We've had so we've been able to do that when we needed it electronically. But it's more just about like finding the patients that are out there. Like there's so many people who, especially the adults who are diagnosed with Far's disease, who've never got genetic testing. And those are people we need because I think we're seeing that the pediatric phenotype is one thing. But the later onset phenotype is a different thing, and both of those communities deserve to have access to treatment. But the kids are actually going to be the ones to be able to show us that the drug is effective, because especially if they're on a specific time course for their progression, it's tighter. So if the kids are on this timeline, the adults are on this timeline. And so the kids will also help the adults, which is usually backwards from what we usually do, because we usually trickle down therapies to kids.
Gotcha. How can I help with the awareness part with the FARS, because that was kind of new to me when you spoke about that yesterday. Because I already had, before I was coming, the idea to kind of copy off of Sisters Hope Foundation, where they're providing toolkits for their specific condition, and they are dividing it out into like 7 mailings, and then they're sending it to, I think, pediatricians and neurologists. And I want to do something similar. It's a lot of work, and I'm sure it's thousands of dollars, but that's like kind of my next thing I want to do. If you think it's worth it,
I think that the awareness thing comes in different buckets, and I think that is a conversation about like what they're doing with that, because mailings may be not as helpful as sending PDFs through the email. Because most folks these days don't look at their mail for weeks on end.
True.
And emails are usually better. And the other thing that you can do is we can try to do what we could do. Let me think about this for a second.
Because I'm just thinking, if every board member or if I even did an outreach to the entire patient community and said, here, like I give them the toolkit, I give them the PDFs that I've created and all the information that, you're saying that these doctors need to know. And if I can somehow get them then, in Canada, there's 2 families. In Australia, there's, like.
So the other interesting thing is while y'all have an LCC Facebook group, that doctors also have Facebook groups and social media, right? And so once we get these put together, and we can work on it together. And we'll pull Dr. Harmon in and some other people too.
Perfect.
But once we get them out, you guys can share them among the patient community, but you can also share it with like the FARS group, because if people have had a diagnosis of FARS, but they have negative genetic testing, they might have LCC, and they should be considered for the diagnosis. That's the first thing. And then the second thing is we blast it on social media. Like what used to be called Twitter, you put it out on Threads and on Instagram and hashtag Med Twitter, did you knows? I refuse to.
I am continuing to detonate Twitter.
The artist formerly known.
I do occasionally use the X to make a sh sound and then end it with the last part of the old name. When it really makes me mad. But we can use that, I think, that model. Zach got it. Zach.
There's professional groups too.
Yes, and so we can go to the American Academy of Neurology, we can go to the American College of Medical Genetics, we can go to the AAP, and there's specific clinical update literature that comes out, it's like little newspapers. But we could also put something in there. We could reach out because I'm a member of the AAN. I'm not a member of the AAP, but I know people who are, and then I'm a member of the American College of Medical Genetics. And so we can do those things too. But sometimes I'm telling you, one of the biggest sources of patient catchment for us on the clinical side has literally been a women's neurologist group, where they have gone in and said, I have this patient, I don't know what to do, can somebody help me? And it's been Jenny Harmon on this women's neurology group going, please send this person to this person and call Dr. Fraser. Here's her email, and here's her cell phone. And it's like, and it's happened. We've gotten patients out of community hospitals where they didn't know what to do with patients into an academic facility where I can walk with people who I know at those places. And we've gotten them enrolled in the studies because of that.
Yeah.
So
that's awesome.
It does help.
I mean, a lot of what I've heard so far too during this conference is that a lot of patients were diagnosed with their leukodystrophy after a second opinion. So that was kind of that's when I look back on our diagnosis, it was a second opinion, but crazy enough through our insurance company who offered it to us.
Yeah, that the UHC second opinion care system that they had, right?
Yeah. And
that's a good thing.
I got an entire printout, and it actually mentions leukodystrophy and Dr. Vanderveer and all of, and so when we came back to the States, this was all because we got that extra benefit, I believe, on insurance because we lived overseas at the time. So I don't know that that's a common thing for people to be able.
Some of the insurance companies here do that too.
Okay,
there are
it is standard. Okay, because I also would love to advocate for that. That is how we got connected to the people we needed to get connected to, and then we're able to do genetic testing through the research, and it was covered. So then, because now a lot of people are struggling to even pay to get genetic testing done. So then
but we can help with that specifically for LCC. We can't cover it.
The problem with that though specifically is people have to action it. Because I think the segment thing is fairly standard.
If you know to access it.
Well,
which we didn't.
If you know to access it, or sometimes you'll get the outreach, because we actually got the outreach.
We got the outreach.
You got an outreach when you were going through cancer, and you were like, this is a waste of my time, I know what I'm doing, I don't need to do it. He's like, threw the paper away. And you got I'm sure people do that with this situation too.
Because they're also under stress.
It's hopeless, I don't know, whatever, and they don't, they actually have to action it, and there's no way to force that upon people.
Yeah, I know.
So
I guess that's true, but if you, with a leukodystrophy or being undiagnosed, being approached, that's why we did it. Because he was undiagnosed, or we had, maybe it's cerebral palsy. But it was we don't know.
That was an Italian guy.
It wasn't an Italian doctor. Yeah, he was.
I don't know. I mean, there's a really good, great leukodystrophy group out of Rome. There's a really great one in the Netherlands. There's lots of really good centers everywhere, but you got to be able to get to them. You know.
Yeah.
Okay, so I think catching these folks closer to time of presentation is important. The other thing that I'm going to hope to do, and I'm going to have to figure out how to do this, is actually getting the neurologist, the neuroradiologist, the people who read the MRIs to be like, oh, this is a thing I need to know about. Because if they don't put it on the differential, a lot of the times the neurologist won't even cop on, the adult neurologist. We had one adult neurologist in all the posters that I looked at who was excited about leukodystrophies. But if your neuroradiologist isn't aware and on top of things, they're going to call it Farsh disease and they're going to move on. And even in not every hospital has a pediatric neuroradiologist. So if you go get an MRI at certain places, even in big cities,
Yeah.
they will not have a pediatric neuroradiologist who's trained to look at kids' brains. And so oftentimes those brains will be diagnosed or mischaracterized by the person reading the MRI because they don't know when myelin is supposed to be there. They don't know when what's normal, when it looks like it's going away. They just don't know because that's not what adult brains do, and they're not trained to look at kid brains. So getting out to the neuroradiologist is a big deal too. So one of the things that's happening is I literally just signed off on a case report of one of our patients that is being done by to get out to the neuroradiologists because of this patient's presentation. And it's a really quick and dirty thing that they just pop a little spotlight on for an imaging and case report. And so that's why we're doing it. Is every time we have something that's important that we can get out quickly, we're getting it out. Like these poster meetings, like we take posters to every meeting we can go to. So I'm not going to Child Neurology Society, but Jenny and Julie and Dr. Toshin are. And so they're putting up posters. They're talking about all this stuff. We took it to the Society for Inherited Metabolic Disease. We took it to American College of Medical Genetics. We are doing everything we can to sort of spread the word in places that should be seeing this, but the pediatricians also need to be thinking about it. To know to refer. And so like Ben didn't have a story where he should have had CEP. He didn't. He didn't have a setup for that. There are specific kids who should have specific setups for CEP, and he doesn't have that story. And so, and if you take the combination of this like CEP diagnosis and an early seizure without any reason to have that, and you have an MRI, you should be able to take all of that story together and be like, this is suspicious. And you should be able to get to a diagnosis. Now, granted, there wasn't a gene until 2016, so,
so there is that,
But,
he was
you know,
born 2013, so. I mean,
And
that
again,
was
we need to
already
get-
3 years before they even discovered it. But yeah, I never stopped because it was very suspicious. And then there were subtle signs of mobility issues and always fine motor. And
Even from the
speech
very-
was like,
on the edge.
you know, like, so.
Is that weird hand thing or what is David?
Yeah,
He always had
keeps,
his
like-
thumb in?
Yeah, he always keeps his
Really?
thumb in. Yeah,
For like both thumbs or just the one?
just one.
Is it just the one that's worse?
Yeah, I got pictures of videos
Yeah.
of Shark Time.
And I think it's the left. Yeah.
Yeah. For the most part, but some kids have a really hard time getting language to catch up anyway. So
Yeah.
yeah. So we just, I mean, it's going to be about getting the word out, and I am going to blow it up when we can get it out there because it's got to happen. So I can, what I might do is I might pull like once you guys get closer to this outreach packet thing, we might actually have you meet with some of the liaisons for some of the labs
Okay.
with me.
Sounds great.
Okay.
I'm ready.
All right. What questions you guys have, Zach? You don't have any questions?
You don't have questions? Yeah, he's just wondering about his test.
Okay, yeah.
Which we don't have yet,
Not
but
yet.
soon.
I'm kind of curious too. I'm new to the LCC space. I'm just trying to learn
Yeah.
everything. Is LCC Foundation the main patient advocacy group that folks are going to, other than the Facebook
I mean,
group?
there's
right
literally
now?
the only.
Yeah,
The
yeah,
only
we
one,
are the
yeah.
only one.
Wow.
Yeah.
Yeah.
And after Ben's diagnosis, is that kind of what made you want to take a leadership role?
Yeah, that and she needed someone.
Needed a
And
buddy.
another family had attempted to do this, and they
They
were
were in a harder place at
they
the
were
time.
in a harder place and they were unable. So I said, I almost knew that it was coming. And funny enough, I had started taking like a little online course on how to form a nonprofit. And I think I was on not even through lesson 1 and she called me.
Yeah.
And said,
So,
we have this opportunity,
we need to
which
try
we
to get
didn't end up
this.
getting,
We didn't get
but
Advocacy groups have such a powerful
Yeah,
role in
yeah.
driving all of
Yeah.
this work.
Yeah.
yeah.
So our LCC Foundation is about a year and a half old?
So we got
Yeah.
started, and then we kind of had to go on ice for a while.
We did have to, yeah, it was 22. I got spring of 22, we got started. Fall of 22, I was diagnosed with breast cancer, stage 1, so it was like early, and I was able to Yeah, like, be able to
and
deal
all
with
the
it
other things
quickly.
she's already having to do with 4 boys and being Ben's primary person, 5 technically. I try to give you credit for being a grown up, Danny, but you know, if you must.
Yeah, so I had to, go on ice, like you said, and get through that. And then I think my first, like, back at it was when we went to the World Orphan Drug Conference.
Yep.
Right. And that
And
was
that, like,
In DC in the spring.
and I was like, all right, I'm good.
Yeah.
that was the launch pad.
Yeah. I was like, come on out here and let's see about doing this. And it was like, and we
I
were
was
in it.
there, yeah.
Yeah.
And then, I've been,
Using carrots.
going.
That you guys are doing.
Yeah.
If the clinician doesn't have, like physician scientist doesn't have a PAG, nobody takes you seriously. Like the granting organizations don't take you seriously. The NHGR, like the NDS guy was like, we need to have your PAGs involved. You need to have all this stuff. And I was like, I can go on and do all this, but I really have to have that. So
Yeah.
Here's the tough
Yeah.
part. And if you really want to laugh,
That is
that's
so
why.
stinking cute.
What is that one?
is that toilet paper?
Oh yeah, that's when they're toddlers and get into the toilet paper.
It's
Oh,
the same spirit, like the same, like.
Yeah. Oh yeah. Yeah, like you.
Like, see what I did? I literally
He's
just,
got
that thumb is tucked, but like,
Yeah.
And sometimes he would even use it, like
Yeah.
he would be like hitting the back end.
Yeah. oh my God, I love this child so much. Van Dyke is my spirit animal. Okay.
And I'm curious, how were you guys connected along the journey?
How did we connect?
Yeah.
How did you originally connect?
Well,
Because it sounds like the diagnostic journey is.
so I did not make the
So
diagnosis.
second opinion
Yeah.
was the start that got us connected to
Yeah.
CHOP and Dr. Vanderveer.
And
then
yeah.
Sent it to us.
And then
And these guys came to see us, I guess, in 2022, late 2021.
Yeah.
Because by that point, we already had each other's cell phones.
Yeah.
And
Yeah,
so
he
by
was
spring of
diagnosed spring of 21,
Yeah.
April of 21, and then, as soon as I got her contact information, which I think at the time was just your email, I emailed you,
It's like
and then you're like,
when
yeah,
that happened.
yeah,
'Cause you wanted to talk to us, and then it was like.
yeah, so and I messed up the time because she's on East Coast and I'm Central. Remember
I do that
Our
too.
first,
I do that too. It's okay. I'm really bad with time zones.
and yeah, we had that first Zoom, I'm like in the car because I didn't plan that well.
What questions do you guys have? We don't know what questions.
Yeah.
to have. That's the.
And I was like, well, let me just start from the
Like,
beginning.
Yes.
Tell me what you like. What
Yeah,
have you been
so
told?
I gave her kind of, all the info on him, like that she needed, like
Yeah.
was he premature, which he wasn't.
No, but he had
And,
that early
like,
seizure.
Yeah, the early seizure and like giving all that information, and then, yeah, she asked what questions do you have, and I said, how can I help you?
And
So-
then and honestly, you
So
know how
that, yeah.
sometimes there are just those people that you just
Mesh.
mesh.
Vibe with.
Yeah.
It's a vibe.
Yeah.
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 And that's what, like, every time I say, oh, I work with, like, working closely with Fraser, they're like, oh, she's a force of nature. And I'm like, yeah,
Well,
that's,
us too.
yeah, that's
Danny's-
what we're doing.
When we have these meetings, Danny's like, I'm just gonna go.
I'm
You tell me when you need me.
Yeah,
Pretty much.
pretty much.
What?
Yeah.
There's another one. See his hand? It's weird. Now you got me like looking at humanoids.
Oh,
It's,
yeah.
like,
Yeah.
weird.
That's his left,
Yeah,
left
look at
thumb.
that.
Left thumb. He's gotten bigger though. I can tell a difference.
Yeah,
Oh,
he's gaining weight. We got the G button March
March Madness week.
March Madness
yeah.
week.
Tuesday.
Yeah,
Yeah.
Monday.
he definitely, yeah, like he
Bowling
just,
is strong.
yeah,
Better. Like
Yeah.
he,
More energy.
yeah,
today wasn't so. Yesterday was kind of like.
But again, travel is stressful and
Yeah.
it's a lot of work.
yeah. Yeah, he loves his mom
Oh.
like a ton and prefers that I do everything.
Great.
Dad's late.
Even though I took you today and busted.
You didn't get anything?
You didn't want anything.
Man, the
Sean,
best guy.
He just wanted to come home. He just wanted to come home.
Yeah, we went in Oklahoma, we got like
See? See?
You just wanted mama?
He
is
got
that what it
everything
was?
in his mom because mom took him in the store, and so then he's like, I want everything.
Yeah.
and then he
And then he was was good.
So I heard something about lemon cheesecake though, Ben. I'm just
Oh
saying.
yeah, it was like the lemon
Ben
cheese
and
tart.
we love some similar stuff. You got to
Yeah.
try that tres leches cake
Yeah.
again. I'm thinking he's gonna love it. Man.
So good.
All the calories you should never have. But Ben can have all of it.
Yeah.
That's what they had at your aunt's. That's what they
Is
made.
that what that was? Oh, at Aunt Amy's, yeah.
Because remember then they were quizzing. They were like, well, did anybody know what this means? Like,
3
milks?
But like when one of them is sweet and condensed, you're like already winning.
Yeah. Which is what his cans of formula remind me. I feel like I'm pouring out
Or carnation. Well, that's not sweet and condensed though. That's the evaporator. The carnation is that stuff that's like, and you can like.
Yeah.
Danger. You'd love it.
That's what you put in pumpkin.
Yeah, I was
pie,
telling
right?
Toshin and Julian I was like, yeah, the traveling equipment situation's gotten real fun now that we have like, he needs the toilet to be able to use, right? So like it folds up, but it's still
not
bulky,
small.
right?
And it's
And then
heavy.
Mom got him a mattress because like the bed situation's never ideal in a hotel, right?
And it's been
Did you hear
game
about this yet?
changer.
No.
I love this thing.
So
Is it inflatable?
anybody that needs a recommendation, tell
Yes.
Shan, tell whoever, like this thing.
But it's
is
only for like smaller. When
You
you
could
get,
get even bigger ones.
could you
than
get a
what they
bigger
have.
one?
What are
Yeah, I don't know.
It's basically like a pool raft material. And so you inflate, and
Yes.
it has a bag that it contains, so it's like really nice for It's got
Yeah.
the pump and the bag all goes in there. And so it's only about this big.
Okay.
Yeah, and then you have like, it's like,
So essentially, Ben has his extra suitcase with all the stuff.
That's what we ended up doing this
Yeah.
time. Like we
Yeah.
had it packed in all these different
yeah.
things when we went to Oklahoma, and I was like, we're getting ready to go to the East Coast, and we're taking the train from New York to Philly, so I need to figure out how.
Just get one of those big old 28-inch suitcases,
Yeah.
hard side
Yeah.
suitcase, and
Yeah.
roll it.
We put
Yeah.
the toilet seat in there, and the mattress in there, and
Yeah.
some stuff.
Yeah.
And the Yeti because it's not refrigerated, so I've got the Yeti, so there you can ice that. I told them, I was like, I reached out to the TSA, and I was like, I'm bringing a lot of liquid. So you're just gonna have to be okay with this.
What'd they say? They were okay with it. As long as it's a prescription medicine, they shouldn't care.
Well, no, like all this formulas, like.
Oh, yeah.
yeah.
We're having it shipped to Philly, but like I've still got to take like 20 cans for like the first 5 days of the trip.
They can't say no.
They can't, but like I just didn't.
They can
want
just
to
make
deal
life
with
hard.
that. I'm like I don't want to deal with.
Hopefully they wouldn't.
This is why I drive to everywhere, and I don't even have all those things.
Yeah.
I'm literally like, TSA, hard pass. I'll just drive to Chicago, because between Reagan, Fort Dulles, I sure did. Between that and O'Hare, I was like, I'll just drive.
I'm not interested in that.
There was nobody on the road. There was nothing here. There's nothing. It's like, the only place I hit Chicago was like as I came into Chicago. Traffic.
Yeah.
That was where traffic.
Yep.
It's like, okay.
Yep.
And that was like the longest 20 minutes of my drive.
Yeah. Same.
So
You live.
I don't know. Consider an RV. I'm just saying.
Yeah.
X is full.
Do you guys have any questions from here? No.
Oh, on the chat.
I think we only have. Hey, who's mom?
This is Stephanie.
That's no. I think it's MCM, right? Or is it? Does it say mom?
It's in
Oh, that might be Martha.
Oh yeah. Yeah.
If you guys have any questions, this wasn't planned to be a formal presentation, but more of a roundtable. But put them in the chat for us. We've got a few more minutes.
Just want to thank you guys for letting me.
Oh, thank you so much.
Yeah. Thanks for.
All the good work you guys are doing.
Sure.
Oh, thanks. Yeah. Thanks for listening in.
Yeah.
I'm excited to kind of see how
Us too.
Yeah.
We're gonna go up.
Yeah.
Gonna go up. Yes.
I hope so.
Are there any other
Probably gonna need a biotech partner at some point.
No.
We're definitely gonna need a biotech partner at some point. For sure.
Wink, wink. There isn't, but there.
We're
the-
trying.
Yeah, Canada would really love to have a charity, LCC,
Mm-hmm.
like sister
LCC,
foundation.
Sister Foundation.
But navigating that is a bit tricky. And I believe the president, Ron, of the ULF, they are a Canadian family. And I mentioned, forming a Canadian charity, and he's like, oh. Anytime we like brought that up, even on social media, the comments are, oh my gosh, that's a lot of work, and I'm like, but people said that about the U.S., and I formed it in a day, so.
How is that process then? Like,
So
Flex, yeah.
yeah, flex. Sorry.
If anyone could, it's you.
So I can't imagine it's that bad. If you know a little bit of the law.
You said you have a legal background.
Yeah, so I have a legal background, so I knew how to file things with the courts, so with the county and then the state and all that. So I knew that, and I know there's filing fees, and that's where the cost comes in, and they want to have certain like paperwork attached to the applications and all that. So I know how to navigate the system. So I'm hoping I can.
I'm gonna send you something I just
Yeah.
found online.
Huh?
I just texted you something for later
Okay.
that I just found.
Okay, yeah, so I feel like it's something we can figure
It's
out
the
and
Canadian
do.
Nonprofit
But that's, yeah,
Academy.
because I think that would help them, because then they would be able to go, because I think they're very big in their community already, so
Yeah.
they've raised,
Yeah.
they
Lots
did,
of
The Canadian.
the Canadian,
Yeah.
one of the Canadian families,
Yeah.
yeah, they've raised, I think it was 15,000 just in one event, doing
Yeah.
like an auction, which is phenomenal. And then they were approached at that event to then do like a golfing thing, and they would have been guaranteed 30,000 had they had
Their
their
nonprofit status and what?
nonprofit status. So she unfortunately had to decline because she doesn't have that, and so she's reached out to us to try to get that going, and so that's on the list too, is to
Seems like
see
you're
if we
almost
can
like
do.
a little bit of a catch-all for some of the international
Yeah,
folks.
yeah.
You
Yeah.
see that.
Yeah.
Which is a good thing, that
Yeah,
they're
which
finding the group. If you're the only group, it's the easiest to find.
Yeah.
You see that a lot in rare disease too.
Yeah.
Incredible work that you're doing.
Oh,
Really.
thank you. Yeah.
These guys are amazing.
She's got all the smarts, and I'm just trying to. I'm just trying to help.
She's the force of nature that's making it all happen.
You are. You really are.
And like we can't do enough without the patient involvement and
Yeah.
engagement. And the thing is, like Laura Adang did a really nice thing where she was talking about like we would need to listen better to families, and like we started this journey with like tell me everything about what happened, tell me exactly how things are going.
Yeah.
So
I just saw it move, so I didn't know.
You know, as we move along in drug development too, the FDA wants to do those patient listening sessions with
Yeah.
families and with the PAGs. I just think it's wonderful that you've taken all of this on to be that voice and community that's so needed.
Yeah. Thank you. Yeah. I'm hoping to get more people within the community involved, and I'm thinking through the website and a private portal, because that's what kind of has been voiced so far with patients, is that they want to be able to talk with one another, but they can't do that openly
I don't feel comfortable
on,
doing it on Facebook.
yeah, on Facebook, or even like on Zoom, like face to face, just to be able to get on a portal and private message someone, knowing that
It is safe
it's
and
safe.
secure.
I've heard
Yeah.
another rare disease group is toying with the idea of having like fireside chats like every 2 weeks with
Yeah.
the leader of the PAG and just saying, hey, if you just want to chit chat with others in this like private enclosed space, I'm around every Friday from like 5 to 7 p.m. or 7 to 9 p.m. Like come join me. Maybe it's 3 people, maybe it's 10.
Yeah.
It's private. You are with your community and it's like a safe space to share wherever you're at in your journey. So I've seen other
That's
PAGs
cool.
considering that and others who are farther along who have had success doing it.
Oh, cool.
Yeah, that's a good idea.
Yeah, I tried to do, I tried to do that, like I forgot what I called it, but like a community chat or something, and because I do have LCC Foundation Zoom account, and I was trying to do it on there, and I had one person show up,
And sometimes maybe
so,
it's
but it was good, a conversation,
still
so,
a conversation. And
Yeah.
it's a way to preserve your time too, because I feel like so many
Yeah.
rare disease PAG leaders are you're doing so much outside of it. You're working as a full-time parent, and it preserves your energy and your time. You have this dedicated space, so you're not burnt out too.
yeah, exactly, yeah.
That's what I've heard at least.
Yeah, that's a great idea. Yeah, I'll have to just keep pushing it out there. I haven't put another one out there because I was like, oh.
Maybe sometimes it helps to have themes too, like
Yeah.
like helpful resources that you have found. You
Yeah.
know, like this is the place where you can like this is the one where you bring up your
Well,
inflatable bed and your special
Yes.
toilet and the
Well,
magic suitcase. And
Accommodations or things that
Yeah.
make them
Yes. Yeah, and this ULF conference, I've taken notes on every session, so obviously not just like every session I tried to write things down. And so I'm thinking, yeah, I could even have in newsletters take, like what I learned
Yeah,
from
from
ULF
ULF.
Yeah.
or something.
Absolutely.
Yeah, like,
Insights.
yeah.
Insights from the ULF.
Yeah.
And we can talk about some of this.
Reposting this session where you guys had that candid conversation is a really powerful.
Yeah, I need to share that. Yeah, I need to share that. I don't know, other than the community, I don't know that I've shared that with everyone.
And it's
So
like a
that,
snowball till you put it out there, maybe it doesn't
Yeah.
get so much traction, but it's there as a resource for people in a year or 2 years from
Yeah.
now.
yeah,
Just keep building.
yeah, keep going.
Sort of like I
That's
mean, think of it like when you get the new website done. I don't know if you've got all of it built out, but like a community tack board almost for like, here's my story, like here's our story, here's somebody else's story, and they like get tacked up. I saw the kids' stories, but like, there should be like maybe a caregiver space as well, where like
Yeah.
people are sharing their journeys and how they're handling things. And I think sometimes people are afraid to be vulnerable, but maybe
But
something
yeah, if it's more
needs to
just
be
like
done.
one question, one-off thing, and then,
Yeah.
that'd be a great idea.